So, since there seem to be so many benefits to a universal healthcare system, you might be wondering. Well, actually, I was gonna ask, why haven't we done this yet in the US? And if I was gonna answer that question, I'd talk about how the healthcare industry doesn't want things to change. Some segments of the healthcare industry, like pharmaceutical or insurance companies, have a big stake in maintaining their profits. So they want to keep things as expensive as possible. And to keep things the way they are, a lot of the healthcare industry spends more on lobbying the federal government than oil and defense. But that's if I was gonna answer that question. Instead, let's talk about where we go from here. How do we get to a universal healthcare program? Well, it's gonna happen when people demand it. Legislators have tried to create a universal system since the early 1900s, but they've almost always faced resistance in the US. That's mainly due to a lack of understanding. So to start, spread the word. Get people on board with the idea of universal coverage. Share these videos. Help people understand how they'd benefit. You can also talk to your lawmakers. Tell them you're a constituent who is interested in universal coverage. And when proposals for universal or single-payer system come around, either at the federal or state or even city level, pay attention. Those proposals might get some traction with your support. Now, there are a lot of ways our system could change. Could it switch overnight to a universal system? Maybe, but it's probably going to be more step by step. We could come up with ways with regulating costs to make things cheaper. We can regulate our insurance companies and just require that they cover everybody. We could have a plan that slowly expands Medicare over time. It could cover children, then more adults, then eventually everybody. There are lots of options, which is why we need to support organizations like the California Physicians Alliance, who have created a roadmap for how we get from where we are now to a universal system that would cover everybody. Together, we could find our way toward a healthcare system that works for all of us. Check out some of these links for more info.